Ectopic pregnancy. This presentation is done by Joana Lucero Blancas on March 16, 2021. Typical patient presentation. A 35-year-old woman comes in complaining of a sudden abdomen pain and is urinating frequently. She states that she is sexually active and not using birth control. She has a history of pelvic inflammatory disease and recently has had a vaginal bleeding. Etiology. Ectopic pregnancy is a pregnancy outside the uterus. There are several different types of ectopic pregnancy. One of them is tubal ectopic pregnancy. This is when the implantation of the embryo is located in the fallopian tube. This can be caused by inflammation. The inflammation of the fallopian tube can be caused by toxic immunological infections and hormonal problems. Etiology continued. Another type of ectopic pregnancy is ovarian. This is when the embryo is implanted in the ovaries. This happens because the ovum was not released due to a ruptured follicle or a tubal malfunction, for example, inflammation. Another type of ectopic pregnancy is abdominal ectopic pregnancy. This is when the embryo can be located throughout the abdomen. This happens because the end of the fallopian tube does not notice the ovum was released by the ovaries, which leads to improper implantation of the embryo. The fallopian tube have cilia that help move the embryo down the fallopian tube into the uterus. With the fallopian tube not knowing the ovum was there, it was not able to properly direct the ovum into the uterine cavity, which led to this ectopic pregnancy. Etiology continued. There are two more types of ectopic pregnancies. These are heterotopic and interstitial. We cannot find a clear cause for why these ectopic pregnancies happen, but heterotopic is when there's two embryos. One embryo is a normal pregnancy, and the other one can be a different type of ectopic pregnancy. Interstitial is located interstitially and not in the uterine cavity. We can see this in the image. There's an interstitial ectopic pregnancy. The fallopian ectopic pregnancy can be located throughout the fallopian tube. The ovarian ectopic pregnancy is located in the ovaries. We can also see a normal implantation and a cervical ectopic pregnancy. Background. Incidence of ectopic pregnancy cannot be accurately calculated. This is because most ectopic pregnancies end up with miscarriages and are rarely registered. This is why most of the information is rough estimates. The estimate of incidence is around 2% of pregnancies. 95% of all ectopic pregnancies are tubal, like fallopian tube pregnancies. 9 through 13% of pregnancy deaths are related with pregnancies outside of the uterus. Risk factors. History of pelvic inflammatory disease, endometritis, gonorrhea, chlamydia infection, previous ectopic pregnancy, previous tubal surgery, and pelvic adhesive disease. This is when scar tissues bind adjacent organs together. When scar tissue forms, it prevents the embryo from going down the fallopian tube. This can lead to a fallopian ectopic pregnancy. Risk factors continued. Tobacco use, ciliary motility disease. This is an autosomal recessive disorder that makes cilia, which propels the ovum down the fallopian tube, defective. Another type of risk factor is assistive reproductive technologies. This increases the risk because they place the fertilized egg directly into the fallopian tube. Normal implantation of pregnancy. In a normal pregnancy, the egg is released from the ovaries. The egg is then fertilized in the fallopian tube. The fallopian tube then pushes down the egg throughout the fallopian tube with the help of ciliated epithelial cells. The fertilized egg is then implanted in the uterine cavity. Pathophysiology continued. Bacterial infections such as gonorrhea and chlamydia can cause inflammation of fallopian tube. The inflammation of the tube can cause scar tissue to be formed. The scar tissue forms blockages in the tube, inhibiting the correct implantation in the uterine cavity. This is because the scar tissue will prevent the embryo from reaching the uterine cavity and stop it at the fallopian tube. Pathophysiology continued. The fertilized egg is then implanted in the fallopian tube. As the embryo grows in the fallopian tube will expand. The expansion of the fallopian tube can lead to rupture, which is vaginal bleeding. The vaginal bleeding can cause the loss of blood, which can lead up to shock. Pathophysiology continued. Blood that was lost can build up and cause pain in the abdomen or pelvis. This will cause the abdominal and pelvic pain that most patients feel. Loss of blood can also cause low blood pressure. Symptoms: vaginal bleeding, abdominal and pelvic pain, urinary tract infection. This can lead to pain while urinating and a cloudy urine, and abnormal frequent urination. Symptoms continued. If the uterus ruptures, then these symptoms would be present. Patients will have low blood pressure, lower back pain, dizziness or fainting, and a palpable mass. Diagnosis. You can use a transvaginal ultrasonography to tell if the patient has an ectopic pregnancy. In the right, we can see an ultrasonography depicting an ectopic pregnancy. In the endometrial cavity is where we would want a normal pregnancy to be, yet we see the gestational sac is above. That is not a normal pregnancy. Another way we can check for ectopic pregnancy is check for a decline in the gonadotropin levels. You can also check for abnormal decrease in progesterone. Lower than 60 nanomoles per liter of progesterone is a sign for ectopic pregnancy. Treatment. This is if there is a rupture to the vaginal cavity, which leads to surgery to remove the embryo. The second type of treatment is if there's no rupture to the vaginal cavity. This can be treated with methotrexate, which inhibits DNA replication and decreases the levels of gonadotropin. This will lead to a miscarriage. The third type of treatment is if the ectopic pregnancy cannot be taken to term, but the normal pregnancy will be managed. If there is no rupture to the vaginal cavity and the gonadotropin levels are less than 1500 IU per liter, this will require constant checkups. This means that in a heterotopic ectopic pregnancy, the ectopic pregnancy will not be taken to term, but the normal pregnancy can be managed and be taken to term. Here are my references. Thank you.